Now, India now has the fourth highest number of coronavirus deaths in the world. The total number of people to have died in the country from COVID-19 has now surged past 47,000. India also saw its biggest single-day spike in infections on Thursday. 67,000 COVID-19 cases were reported, taking the total number to 2.4 million. India has the biggest caseload behind the United States and Brazil and has seen a jump of 50,000 cases or more every day for the past 2 weeks. For more, we can go across to France 24's Diya Gupta standing by in Delhi for us. Diya, what measures are being taken to limit the spread of the virus?
Well, like you said, right now the situation is very, very concerning. We've now passed the UK as well, becoming the fourth worst affected country. 50,000 cases plus every day for 2 weeks, and we hit another high yesterday with about 70,000 cases reported in a single day. So we're nowhere close to tackling the pandemic here, and people are now questioning the measures that the government is taking. So far, the Indian government has focused the bulk of its energy in imposing a nationwide lockdown when the pandemic first erupted here in the country. However, those early restrictions have been eased over time in most states. So economic activity is ongoing even in places like Delhi, which has been quite strongly affected by the virus. This might not be the best move. The metro places that attract crowds are still shut, but in many ways, life feels like it's almost back to normal, which is a great cause of concern. Markets and streets are crowded, shops are open, and residents here seem to not really care about social distancing anymore as we did in the early days. In fact, according to the newest unlock guidelines, some places like gyms will also be allowed to reopen. The measures of control here are governed by each state. So some which are in greater danger, like others in Bihar and Maharashtra, the lockdown has been extended to control the spread of the virus. Where India is not paying enough attention, even now, is getting the testing rate up to par with the population. We cannot possibly know how many people are infected, and there's a great void there, which is a matter of really grave concern.
And Dia, where are we seeing these new cases? Because when the coronavirus first hit India, we did see that a lot of cases centered in big cities, the metro cities like Bombay and Delhi. Where are these new cases?
So exactly, like you said, when the pandemic first erupted, big cities like Bombay and Bangalore and Delhi were the worst affected. And these places really do have the infrastructure to tackle a virus to an extent. Experts have been warning us for a while that the real danger of this pandemic will come when it spreads into smaller towns, states with higher populations, and not the economic might to tackle something like this, and overburden the healthcare systems there. We're beginning to see this now. The virus is spreading to states like Bihar and Uttar Pradesh, which saw migrant workers coming back by the hundreds and thousands when the lockdown first began. So these are people who lost their jobs and homes and went back home, probably carrying the virus with them. Uttar Pradesh and Bihar are now seeing spikes in cases. Bihar has gone back into lockdown, and the healthcare infrastructure is already beginning to collapse. Right now, the most worst affected states are still Maharashtra, Andhra Pradesh, Tamil Nadu. But again, the rate is slightly decreasing over here. So India is just bracing itself and hoping the status remains stable and states like Bihar can tackle the wave that's about to hit.
We'll see what happens, Dia. Thank you very much for that, Diya Gupta reporting there from Delhi.